Got enough participants to get going. Thanks for joining, everybody. We're going to talk about telework today. I know you've seen some other sessions, and it's a very popular thing. It was popular with us for a while now, but then it got popular for everybody. So glad you could join us. We're bummed that we couldn't be in Washington, in Spokane, representing Washington. I, in particular, wanted to get to visit Spokane because I've never even been there. But nonetheless, we're glad we could get together virtually. So, as I said, we've got several of us here today. I'm Megan Paul. I'm with the Quality Improvement Center for Workforce Development, and I'm the workforce lead for the project, the entire project, and also for this particular project team. With me today is Sarah Meyer with the Washington Department of Children, Youth, and Families. She is our project site implementation manager. And we also have Tanaya Sunbury from the Washington State Department of Social and Health Services, and she is our project data coordinator. So we're going to tag team today and talk to you about the work we've been doing. Quickly, our agenda, I'm just going to go over who the Quality Improvement Center for Workforce Development is, talk about our decision to implement telework, our process, and a little bit more of the outcome of our development of the telework program, talk about our evaluation plan, some of our early feedback and changes and lessons learned, then all the adaptations we faced for COVID, talk about the future of telework, and offer a few resources for you. The Quality Improvement Center is a 5-year cooperative agreement between the Children's Bureau and the University of Nebraska Center on Children, Families, and the Law, which is where I am. We have several partners throughout the nation, universities and private consultants, forming a multidisciplinary team of experts in workforce, implementation, and evaluation. And we've all had some experience, direct or other or indirect, working for or with child welfare agencies. The overall goal of the QUIC is to build knowledge to strengthen child welfare workforce, ultimately, of course, to improve outcomes for children and families. We have a number of goals at the QUIC, but the one that's most relevant here today is to develop and test promising workforce interventions. That is, our goal is to do rigorous research, to test the effectiveness of workforce practices, to attract and retain a high-performing child welfare workforce. We solicited agency involvement back in the beginning in 2016 through a call for applications, and we received 26 of those. Ultimately, we selected 8 project sites that we felt met our criteria and would best help us meet our goals of doing rigorous research. So you can see those sites selected all here, geographically dispersed with different agency structures. We've got some counties, some states, we've got a tribe, different workforce needs, and most importantly, intervention opportunities for us to do research. So each project team went through a pretty elaborate needs assessment process to decide on an intervention to test. And, big reveal, Washington selected telework. So you can see the others there, and you can learn more about those other sites and what they're working on testing. We'll share some resources at the end for you to learn more about those. So how did we get there? We started by creating a multidisciplinary project team that include frontline supervisors and staff, administrators, representatives from human resources, from IT, from training, from the union, etc. Basically got everyone who might have an opinion on it or be impacted, stakeholders from everywhere we could think of onto this team. And then on our side, the Quality Improvement Center, we provide a 3-person team to each of our project sites, a specialist in workforce and implementation and evaluation. And then we also at each site have an agency-based person who handles implementation, and that in our case is Sarah, that I already introduced, and a data coordinator, so that we have someone on the ground who is both part of our project and part of the agency to devote their time to supporting us. So then we conducted a really extensive needs assessment process, examined a lot of HR data, employee surveys, some of which we administered, some of which the agencies already had, and really looked at those, and lots of other workforce initiatives and processes. Other things to note, the state already had, this particular agency already had a telework pilot that they conducted not long before we arrived on the scene with some of their intake and hotline staff, and they had positive experiences with that and wanted to expand that. So that was a big facilitator for us. Another factor we considered was that the governor had issued an executive order requiring certain efforts to implement telework in government agencies. So it was an expectation that government agencies make a concerted effort to do better on this front. So, those are just a handful of facilitators. Obviously, we weighed carefully, painfully, many pros and cons of this intervention and some others, but those are just a few highlights. So we're going to do a quick poll to just see where you're at in terms of your experience or involvement with a formal teleworking program. So if you could just answer, are you or were you affiliated with an organization, could be profit, nonprofit, that had a formal telework program prior to the pandemic? It's fun to watch the racing on this end. I know you guys can't see it, but how the results display in real time. It's like the one's leading. No, now it's one guy. Let's see, we've got 30-ish participants, so but only we have 20. That's not. Any more? Any last second takers? No? Should we go ahead and display?
I'll go ahead and end the quiz now.
All right. Thank you. Okay. So actually it's a little more than I expected that did have a formal telework program. So for those of you that do or did, if you're willing to type the name of your agency in the chat, I'm just thinking it might be helpful for others to see who is out there that's been through this process of formalizing or has some experience with it. Only if you're willing, don't feel like you have to. So what were the ends on that? It doesn't say the percentage. All right, largely.
19 out of 21, 22 responded.
Thank you. Our evaluator is going to run the math for us, unless I'm missing the math somewhere. All righty. So no takers. I'm willing to share where you're from. That has a form.
Are you, Megan? I can shout out here from the chat.
Oh, I'm sorry. I wasn't at the moderator chat. Go ahead. Yes, wonderful.
No, we have Carol from Georgia actually says that she's been teleworking for the last 13 years with the agency as a trainer and instructional designer, which is
sure.
Great. We've got someone from Kansas Department of Children and Families, Department of Child Services Staff Development. I'm not sure what state or area, but and Christy from Indianapolis. Oh, Hawaii. We've got someone all the way from Hawaii on with us today. That's exciting.
We'd all just be happy to work in Hawaii, never mind whether we're in an office or teleworking.
I'm sure she hears that all the time. And then someone else from Washington State, the Community Services Division, which I think, we're all familiar with.
We've got some partners out there.
Ohio. Someone. Philadelphia. Oh, it says Philadelphia was never allowed until COVID-19.
Well, yes, and you're probably not alone. Anecdotally, we hear that there's a fair amount of resistance, and it's possible we might have experienced some of that as well. To that, but yeah, we're going to talk about how that has changed for folks out of necessity, no choice. Okay, so this is probably about what I expected, maybe a little more than, but we're talking about like frontline staff versus instructional designers and things like that. So like we're the actual direct human service workers having the option to telework is just know what we're wondering about. So at any rate, we're not going to go into too much detail about our development process. Just suffice it to say, it was a team of a lot of people with a lot of different perspectives. It was a lot of meetings. That's the short version of it. But I think our main product, our telework program handbook, says a lot about what we wrestled with and where we landed, again, with that team. So our handout in this session provides links to many documents and resources, one of which is this handbook. So you can check that out for yourself. But as a general overview, we had 4 major sections: basic fundamentals of like, what does the program involve and what does it look like? So if you are considering becoming a teleworker, what would you need to know? Then becoming a teleworker is all the process of signing up and getting approved, or applying and getting approved, or denied, or appealing, and things like that. Being a teleworker, tips for, setting up a workstation and everything for, the day-to-day work, guidance around that, and a similar thing for supervising teleworkers. The handbook has many details, like I said, and many of those would be applicable to probably any organization. There's confidentiality and security and, a lot of just fundamental things about being at home. But I wanted to highlight a few program features that I think are more likely to distinguish this program from others, or to highlight some of the decisions that need to be made. So a couple things we decided on after, oh my gosh, much belaboring. In the end, the employee had to be in the field operations, like a division, for at least 18 months already, and in their current position for at least 3 months. There was just a lot of interest in making sure people were highly experienced before they were allowed to telework. Settle on a maximum of 2 days per week that one could maximum. That someone could telework, and that they could not substitute or make those up, and they were fixed, that they couldn't be floating around every week. There was a lot of concern from supervisors that it would just get too chaotic and it would be difficult to ensure coverage if people's days were kind of moving around all the time. Employees were allowed to use their current agency-issued laptop or tablet. That was another one of those facilitators we had in our decision, was that all the staff, maybe a couple exceptions, already had all the equipment they needed. They were already mobile. We didn't have to face that issue. They were allowed to connect to personal keyboard, mouse, and or monitor, but the agency was not going to provide any supplemental equipment other than an adapter, and no printing or faxing allowed from home. Other key thing to note is that their work schedule remained the same unless they changed it through a separate formal process around their schedule. So we want to distinguish between flexibility in where you work and flexibility in when you work. And I know that for probably all of us, those things got jumbled up in the pandemic. It was like, just go home, work where you can, when you can. We didn't want that, of course. And so it was very clear that they were allowed to combine them. You could both flex your space and you flex your time in a sense, but they had to go through a formal process to make that happen. They were allowed to telework in their home, in the state or in a neighboring state or province on the borders of the state, or alternatively, if there was space, they could request to telework at an alternate agency office that was more convenient for them. And last thing, the agreement would last for a year and they'd have to renew it or terminate it. So just 1 year that it lasted. So then we had another product that we want to highlight is our application and agreement online process. And Sarah's going to talk about that.
Yeah, thank you, Megan. So at the time, prior to COVID, when we were implementing telework and really we felt like successfully implemented telework for about half of our child welfare staff. These are our frontline staff. Because we wanted to make it more formalized, we actually went down the path of creating a formal application and agreement process that employees and supervisors, and in our agency, we have another layer they're called area administrators that the supervisors report to. So it was very important to our leadership, to people within our system, that those 3 levels have eyes on the application agreement. So we went about the process, and because of the support from the QUIC, and because this is a research project, we also needed to be able to capture the data from these applications and agreements so we could see, okay, who was applying from what offices. We have, I think, roughly 70 offices or so across Washington State within our agency. So there was just no way we were going to track all that by paper. So we went to an electronic application and agreement system. And so what we did was we took our paper forms that the state had been using, or different agencies had been using within our state, and that we had used in the pilot, and adapted them to this online format. So I'm just going to high level a couple of these. We'll show you some screenshots from the system. So the first part of the application, and I'll talk about the lesson learned in a minute about the about this process. So ours, and because we had the multidisciplinary team, it was really a great benefit because everyone from HR to IT to supervisors to top level leadership had a say in what they wanted to know about an employee and what they wanted to assess about an employee's ability or likelihood to be successful teleworking. So that's what is in these forms. So this first one is just an employee self-assessment. This is the employee takes an opportunity to rate themselves about and really have to think through, like, would telework be a suitable fit for me? So obviously right now during COVID, a lot of people are teleworking whether they want to or not. And we'll talk about future impacts later, but this was just designed for the employee to look at, is telework going to be a good fit? What's the next slide? This was in the application itself. They had to, this was a lot of great information for Tanaya, our data coordinator, and our researchers on this project. We were able to capture, job title, supervisor, phone number, where they were, and this is the area of the form where they were requesting which days per week they wanted to telework. Prior to COVID, this was important for office coverage issues. Supervisors and area administrators had to figure out who could have which days because they wanted some staff in the office. So not everyone could have Mondays and Fridays. They had to do some negotiating and compromising with employees. But this electronic form allowed us to see all of this information from lots of employees. We have close to 1,600 employees that potentially were going to be teleworking on a regular basis. So this allowed us to see in real time who from what offices was teleworking. And then we also could connect that to IT. We had a really strong relationship with IT. So then they could also be prepared with equipment and other resources. So next slide. This was a screenshot of the application form. Sorry, that's a little bit small. But this is a safety assessment that employees had to complete. And all of these, everything that the employee completed, the employee initiated the application and the request to telework. And then all of this information went to the supervisor electronically via email. And the supervisor was able to look at all of their responses, and then they could have a really informed conversation with the staff member after when they're making a decision about whether long-term teleworking is a good fit for this employee or not. I think it's good to know in that safety assessment, we did not deny people based on a yes or no answer in any of those assessments. In Washington State, we do not go to people's homes to inspect their workspace. We don't have specific requirements about their workspace. We have requirements about protection of information, but no one is going out to their homes to inspect or anything like that. The last part of, or close to the last part of the application is where the employee really is committing to what they're going to be doing when they're teleworking. So this list of possible teleworking activities was generated actually by supervisors and frontline staff on what are the typical things that they would do while they were working from home. If you work with child welfare frontline staff, for some parts of the workforce, they're spent out and about going to court or being meeting with kids or families or providers or things like that. So they had to schedule their time accordingly and let their supervisor know what they'd be working on during their telework days. So I think the next slide is, So all the information was electronically sent to the supervisor, and then the supervisor had to make a decision whether to allow the employee to telework or not. I'm seeing a question in the chat. It's a good one about, did the union have input on the teleworking? And yes, Washington State, we have a really strong labor presence, and the union was at the table in the beginning stages. And they actually reviewed the telework handbook that Megan talked about prior to full implementation and kind of letting it be activated in a sense. So yes, that's a good question. The union in Washington State has been pressuring us for a while to allow telework. Prior to this project in our pilot, telework had been implemented pretty sporadically, and there wasn't a lot of, I use the word fairness across the board. It was really like, if your supervisor liked it, it was great. If your supervisor was resistant, then sorry, you're out of luck. No teleworking for you. So yeah, that's a good question. The union was very supportive of us implementing telework in a systematic way across the state. So along with that electronic application system being very helpful and useful for us, we had an intranet page that staff could go to. We targeted an intranet page that we knew that workers went to on a regular basis for lots of other information. So we made sure to position the telework information on that main page. We created user guides for staff to help them navigate and learn the new system. I, of course, partnered with IT. They were really critical in the success of the implementation, along with HR. Another, I think, special feature that worked well for us was we did lots of training and information sessions for staff. We also broke it up. We did training sessions and information sessions based on your level within the agency. So we started at the top with our what we call regional administrators. And so we had our session with them, gathered their questions, made sure they understood the process and everything. And then the AAs, we had information sessions just for them where they were able to answer questions and raise concerns. And then the frontline staff and supervisors and then frontline staff. We also implemented a dedicated email box, dcyf.telework, where we could funnel it was just a one-stop shop for any question related to telework. And then I was the one that then would triage and kind of shuttle, okay, is this more of an HR question or is this an IT question? And I could shuttle or ticket, pass on those emails to people who could answer the question appropriately. So that's a lot of information about some of the nitty gritty about our process that we had implemented. Tanaya's going to talk a little bit about the evaluation process and how we're going to gather some really great data to see how this impacted our workforce.
Thank you, Sarah. Can everyone hear me? Thanks. So as Megan mentioned at the beginning, this is part of a nationwide center And the goal is to evaluate whether or not the interventions in the social work are leading to certain outcomes. And the outcomes that the Washington State are looking for, and also broadly, is reducing movement and turnover among frontline staff. So meeting that goal will lead to stability of the workforce, and the stability would lead to improvements in child welfare. So you can see, if you think about a logic model, you can see how we're kind of leading into these things. And so that requires a very rigorous evaluation design. And so for Washington State, we looked at and also with the guidance of the work group, and thinking about certain biases that may result, we settled on a clustered randomized control design. So, and as Sarah has mentioned, we have about 16 to 1,800 frontline workers. These are social workers, and a majority of them are eligible for the telework intervention prior to COVID. So about 1,200, 1,300. And as also, as Sarah mentioned, was reiterating, there's 6 regions in Washington State. And at the beginning of this project, there was 47 offices. So you think about just like the hierarchy of the 6 regions, then we have at the beginning, 47 field offices, and then we have 1,200, 1,300 social workers. So, and this is an example of that randomized, that clustered randomized controlled design. So within the offices in a region, the evaluator randomized offices as either control offices or intervention offices. So if you were in an intervention or an experimental office, and you met the eligibility requirements, you could begin teleworking. And that was also staggered. So we started off with one region as our pilot region to work through some of these implementation problems, if anything rose up. And that happened in 2019, and that so and you can see that we started, so June 2019, and then we waited a little while and ended the experiment to those intervention statewide. The control office would then some work 9 months later, but then COVID happened around March. So those control offices were planned to leave the intervention in July, but the Washington State had a governor stay home, stay healthy March. So we that just rolled out along with everything. So we do have some data on those control offices before COVID happened. And then the next slide talks about the evaluation plan. The next slide. So looking at the implementation and also the outcome evaluation, and there's a variety of data sources. And some of those are primary data sources, and then some of them are secondary. So, and that's why you need a data coordinator. So the secondary data sources are primarily administrative data from HR and the child welfare, so Washington State SACWA system. Each state is required to have a system to process these child welfare. And the primary data collections are the interviews, which are going to be focus groups, but now that did move online. Surveys to staff, baseline and periodic surveys. So some of the measures that we will be looking at are fidelity. Were there any changes to telework and now based off of what was planned with the worker. Attitudes towards telework and their experiences. Again, kind of seeing that how the evaluation design, even with COVID, and that change to the implementation, will still be baseline survey. Community mileage and time savings, leave use, that's annual sick leave, tenure, the length of time that an employee is in their position, and then turnover. So even if they don't quit a DCYF, were there any intentions to leave? We can only collect that through these interviews and surveys. Work-life balance, and then communication with supervisors and coworkers. So a lot of this data is still being collected. You can see even with COVID, there was these, even with any evaluation or research, there's always going to be these little hiccups. We just didn't expect a pandemic of this magnitude. So Sarah is going to be discussing some of the annotative, just some qualitative data that we've collected after this poll. Thank you.
Thank you, Tanaya. Yeah, so we've learned so much about our workforce through this process that I don't think we would have, for sure, we would not have gone to the lengths of this process without the support of the QUIC and the research part of this. So it allowed us to make really informed decisions, and it allowed us to gather lots of information from our staff about what are the benefits, real and perceived benefits of teleworking. And so here's our next poll. So we want to hear from you. What are the benefits of teleworking? This is an open comment box. Go ahead and feel free, just based on your own experiences or those of others around you, either past or present. What are your thoughts about the benefits of human services professionals teleworking? I see comments coming in. Thank you. We appreciate hearing from all of you about the benefits. We continue, like Tanaya mentioned, our data collection is ongoing, and I think we'll share some of those benefits. And we have a video coming up that's going to have actually some of our employees also talking about what they perceive as the benefits of teleworking.
And we should probably note that we are not only accepting information about benefits, we're looking at drawbacks and challenges and barriers, of course, too. But
yes,
and
yes,
those too.
That's my, yeah. Thank you, Megan. Yes, for sure, lots of information from a research perspective and from a practical perspective. So I'm going to go ahead and end the quiz now and see some of the comments that came up here.
Oh, and apparently that's not how this system works.
Yeah. Oh, yeah, this is a new platform for me. So yeah, unfortunately I couldn't see any of yours. So a little minute wasted there, maybe possibly, or give you all a little minute break. If
we were so excited that this platform allowed for open-ended questions and responses. We were like, oh, this will be nice.
That's kind of interesting. I wonder where the comments go. Actually, maybe one of our technicians, one of our moderator helpers could help us figure out where those comments went that you all entered. In the meantime,
tab.
Yeah, responses went. In the meantime, we're going to transition to the video. So We had the opportunity to work with a really great crew who came into Washington State and actually spoke and interviewed some of our staff that had been participating in the Telework program. And here they are talking about that.
The Washington State Department of Children, Youth, and Families has about 1,700 child welfare workers statewide. About 2/3 of workers are in high-density urban communities, and about 1/3 are in medium to low-density communities, including towns and rural areas. The state is divided into 6 regions, and workers are located in 44 offices throughout the state.
Seattle, the western part of Washington State, has a huge traffic problem, and look, some of our workers commute long distances and sit in traffic, whereas some of our rural workers end up even driving into larger cities to work.
We serve the entire county, and there's just 5 of us trying to cover those areas. It's very different from our neighboring county, and I think it's just because of sort of the poverty level here.
Sometimes we're traveling an hour and a half or more to get to the house on dirt roads that literally the name of the street is posted on a tree, on a piece of wood.
Child welfare workers balance their time in the office and in the field. They spend a lot of time in their car, meeting families where and whenever they can.
CPS staff spend at least 50% of their time out in the community, interviewing kids, talking with parents at schools, at homes, and then the rest of the time is at their desk in the office.
Workers in all of the offices have a need to work remotely because so much of their work requires them to be out of the office, and so having a timely and efficient way of working remotely in order to enter case notes so that all of the information is captured from their visits, all of those kinds of things need to be implemented by all of the workers.
In a 2015 survey about workforce retention, Washington State workers reported that they needed flexibility and the ability to telecommute to help them stay in their job. In 2017, when Washington joined the Quality Improvement Center for Workforce Development, or QUIC-WD, Telework was selected as an intervention to address worker retention.
One of the things that I like about teleworking is that it gives me space to myself. It almost feels like it decreases the pressure to be constantly moving on to the next thing. When I'm at home, it can be really, really helpful to try and take that step back for myself so that way I can continue to serve other people.
I think it is really good for people's mental health. Even if it's not your specific case, you're hearing the child crying when she's leaving mom at the end of the visit. And so just like sort of getting yourself out of that for at least one day, I think is really, really helpful and will keep staff here longer.
In addition to reducing some of the stress of the job and the office, workers and supervisors report that teleworking is increasing productivity and time to focus on the families they serve.
Telework has impacted my daily work life in that there's less distractions at home. I have more time to focus and concentrate. I am much happier. I am more efficient. I'd say it definitely helps morale.
The number of tasks that social workers have to do is enormous. So being able to telework offers the ability to do some of those tasks that they're not able to manage. We're seeing a reduction in late court reports. We're seeing an increase in service letters to parents. So we're seeing a lot of the really positive outcomes in job performance and production of work.
There was a week where I got all of my paperwork done on Wednesday, so that meant that on Thursday I got to hang out with one of my kids who's made so much progress in her occupational therapy, and I got to paint with her. It was really, really nice to be able to take that time. It felt really good because I feel like I don't see our kids enough.
A telework policy is not as simple as handing someone a laptop and telling them to set up a home office. Washington State and the Quick WD invested time developing guidance documents and an application process.
There's some criteria in place already for who is eligible. You know, you have to be here a certain amount of time to demonstrate that you can be self-directed and autonomous and know how to be a person that doesn't need a lot of direction.
After reading the Telework Handbook, eligible staff ask themselves if they would be a good fit and identify 1 or 2 set days per week they wish to telework. Managers then review each case for approval.
Workers already had the mobile technology. They had laptops and tablets and cell phones.
We're dealing with sensitive material, and so having a system in place that protects those things. We were only recently able to upgrade to the VPN, the virtual private network. We can remote to them and help them from our office while they're working from home.
The Quick WD will evaluate the process implemented and the impact that telework has on the retention of child welfare workers.
I have worked here for almost 22 years, and we have had challenges over the years. It goes up and down around turnover. I would say, as far as with the telework project, having flexibility with schedules is a huge drive for certainly younger social workers coming in. And so, you know, trying to figure that work-life balance and having flexibility in a work schedule is very important.
It has definitely improved morale for those that are teleworking. I think it's, you know, being viewed as a job perk.
I was not a fan of telework when it first came out, and I remember saying, yeah, I'm not doing that. No way. I need to be in the office. I need to be with my people. I need to be in the grind. And then I signed up for it, and it has been amazing. I think that it is really helpful in retaining staff, being able to take that break and be at home 2 days a week and get away from all of the stuff that's in the office. I think it's just gonna make folks stay in those jobs much longer. And it certainly is gonna make me stay here longer.
What telework can help with as far as burnout and turnover of employees is that it gives us an opportunity to do our work efficiently, because then workers start worrying less about entering case notes every month, and they start worrying less about documentation, and they're able to start focusing more on helping their families, which is, I think, what the vast majority of people come into this work to do.
Yeah, thank you, and to all our staff who volunteered to be a part of that video. So all of that work that went into the video and all of this work, you know, pre-COVID, we are actually very lucky that we had selected telework as our implementation. Like, who could have known, right, that we would be thrown into the middle of a pandemic and long-term teleworking almost 100% of the time. So I wanted to share some of the lessons we learned from this process, because some of you might be thinking about or might need to be involved in, you know, post-COVID, what does telework look like for you and for your agencies? So some of the lessons we learned from this process, for sure, coordinating schedules and ensuring coverage was a hurdle that we had to overcome early on. We quickly learned with those first experimental offices that some jobs, it was easier to telework 2 days per week than others. So we learned that different positions could also telework more days than others. So that was something that we learned simply through the implementation and people trying it. We made different modifications to the application and agreement process. Once people started using it, we realized the system that we had created was just had a few too many steps. So we refined that throughout the process. We were lucky, like Megan talked about, and they said in the video, our workforce was already able to be mobile and take computers, and they were all equipped with cell phones. So that was good. So some of the unexpected things, anecdotally, that we learned, we actually heard early on from staff that was nice working from home and having the privacy to make phone calls. And so there were for sure some unexpected benefits that we learned early on. Because of COVID, we overcame some challenges, and our staff are very creative and resilient and have learned and adapted to be able to scan and print and fax documents and figured out processes and ways to overcome some of those technological challenges. So in terms of lessons learned, I think those are the big ones. I think for me, the biggest one, if I had to summarize this whole slide, would be to overcome. I think our biggest challenge early on was the resistance, because it was a new process. It was a new benefit to our staff, a new way of scheduling. And so in terms of overcoming that resistance, we did a lot of communication. We did a lot of question and answer sessions, and brought in lots of people from lots of different levels. So I think that's what helped us overcome that. And for sure, for me, was a big lesson learned about how you communicate to people. So I'm going to turn it over to Megan, who's going to talk about, sorry, Megan, I was going to talk about, Megan's going to talk about the future of telework, because I'm sure that's what everyone is wondering and thinking about. Like, what does this look like in the future? Currently in Washington State, or prior to COVID, our staff were, in the office 1 or 2 days, teleworking from their homes 1 or 2 days per week, and then out in the field. And now that looks very different. Some of our staff are still coming into the office here and there, and it's really depends on different counties in our state, unfortunately, have different COVID rates, and so have different stay-at-home orders and things like that. So our telework program looks a little bit different now than it did, but Megan's going to talk about that.
Thanks. Yeah, so, before there was some balance, as you can see that we've got depicted here. Sort of on the left, there's some work in the field, and in the middle, there's some work in the office, and on the right, you've got some work at home. And so all of that feedback that we got about the successes and benefits, was based on that sort of balance. And I've done dozens of interviews. And like Sarah said, some people do want more time to be able to telework, but a lot still really felt, they kind of confirmed that that was a good balance for them. But then, as we've all ended up experiencing, the COVID just changed everything. And so with so many people being at home, anybody who lived with anyone else was faced with challenges, particularly if they had any caregiving responsibilities, competing, of course, for bandwidth in the home and Wi-Fi and equipment, and caregiving and overseeing remote school here as of late was a big challenge for all of the staff. And then, the other changes is that lots of people are teleworking. We had some balance before remember the tenure requirements. So there were still people in the office, and it was only some days of the week. So of course, telework became the default for the most part, very few people in the office, and obviously having to take precautions if they were there. And this, of course, has required flexibility that was not built into the program. The intent was for it to not be kind of a free-for-all. We wanted it to be fair. Procedural fairness was a really important goal for us based on a lot of the survey data and a lot of anecdotal information we had. Of course, one of the immediate consequences was that, as it was for nearly every organization in the world, I imagine, was significant IT demands. The staff already had the equipment, but they prior were not allowed to take any other equipment home. Well, now they were. People were walking off with monitors and whatever else they could carry, is what I gather. So, that was a game changer, of course. A lot of people were, we did get some frustration with people, particularly at the beginning of like, wait, I'm just going to work on my laptop. I'm not going to have any other equipment. Well, you can if you want to hook it up to your own personal equipment. So after the pandemic, people were allowed to take it home. IT responded by creating more technology solutions, and like Sarah said, overcame things that were barriers initially. And some of our early feedback was like, I can't print, I can't scan, and things like that. E-signatures, getting signatures was a big problem before in the early stages of telework. So the pandemic has really helped. Things that were on IT's to-do list that weren't critically urgent came to the top. And of course, now we have, the drawback of everybody's teleworking, even if they're brand new. And so that makes onboarding a lot harder, and people have less experience. It's harder to shadow other people. And of course, the work itself has changed in that there's more virtual meetings with children, families, and other professionals, virtual court. So, there's just been a lot of changes of things we didn't anticipate and in our planning, but that other agencies will have the benefit of, shall we say. There's a number of facilitators here, and we want to acknowledge those because some aspects of telework have gotten harder. So this, for the most part, is where agencies have landed. But at some point, going to need to formalize what has, temporarily been a very chaotic situation and adaptive and absolutely necessary. But we want to strongly encourage agencies to find something, to formalize it so that it's more sustainable in the long term. I think, Sarah, we should just open it up to the next slide and talk about, in the time that we have left here, for people to chime in as you're thinking about moving forward with telework and formalizing it. What kinds of facilitators are in place now that wouldn't have been if you had to do this a year ago, things you could take advantage of, and other challenges that are going to continue to happen, or other conditions to consider. Does anyone have any thoughts they wanted to share about any of those things? Again, the point is we want you to benefit from the work that we've done, but we do acknowledge that things are different. And for Washington State, they're going to be different. I mean, we're trying to figure out, okay, so when it's safe to go back into the office, what is telework going to look like? I can guarantee it's not going to look like the program that we had set out to implement originally. Feel free to turn on your mic and shout out or enter into the chat. I did want to share an anecdote from the federal government implemented the Telework Enhancement Act or something back in like 2010. And the Department of Education implemented it, and then a couple of years in, they decided to roll it back significantly. And it did not go well, is the short version of that story. Many people were teleworking a lot of the time, and they, without much explanation, and this is important for procedural fairness too, in that a lot of this was decided behind closed doors. And so staff just were sort of surprised to hear that, starting today, moving forward, everyone has to be in the office 4 days a week. And that was a huge problem. And I'm not saying that that's what it will necessarily look like after the pandemic for everybody, but people have gotten accustomed to some things, and people experience a loss of a certain magnitude much more severely than they do a gain of the same magnitude. So I think that's a cautionary tale as agencies start thinking about how to roll it back.
So Megan, there is a participant named Carmen who mentioned the impacts of isolation or living alone that can be, I guess, compounded by teleworking. And I know that you mentioned some recent research on looking at different types of folks and maybe some people who benefit from telework versus others. So I don't know if that would be if we have time to.
I don't remember that study. There's going to be a lot of data forthcoming. You're going to have to remind me. There have been a number of surveys in the last 6 months about, what were you teleworking before? What are you teleworking now? And what are your expectations? And what would you like to telework moving forward? And everybody wanted to telework more than they had been before. I know there are many people that cannot wait to get back to the office for sure. But there may be personality differences there. And I think it's important to think about the nature of the job. I mean, no one got into social work because they were an introvert who wanted to sit at a desk. You and I got into research because we were happy to do that, right?
Yeah.
So yeah, I think there's going to be a lot of data coming out, but forgive me if I'm not thinking of what study you might be referring to.
That's all right. And then Kathy was mentioning the challenge of new staff learning. So and correct me if I'm wrong, Sarah. Yeah, some of the training has been converted to virtual now, but you can imagine just the lift that would be for IT and program staff to get that transformed to a virtual platform is just amazing. So again, I think some of the silent heroes in this project has been the IT folks.
Absolutely.
Yeah, and Kathy makes a good point about the challenge of new staff. For here in Washington State, our system looks so different now. Our court systems are mostly still online and doing virtual hearings. And so as a new staff member, what does that look like? It looks very different. Calling in to a court to testify in court via Zoom than it does going to the courthouse and standing in front of a judge, which can be very intimidating. So I think that's something that the agency, we really need to look at, and how are we preparing our staff currently? But then once we transition, or if we do transition back to more in-person meetings, what does that look like for our new staff in an already very complicated and stressful job?
Yeah, I can speak to, I do the evaluation for all the training for the state of Nebraska for all our child welfare staff. And, it's actually helped with the fidelity of our training. I mean, we had in-person, a whole mock courtroom set up for 25 years is how we've been doing our training, and transitioning that to Zoom was tough. And I know that's a hot topic for NSDTA, and you'll probably see a number of sessions. I know there's several tomorrow about virtual training, so you can catch those. But it actually we're just astounded at what we've been able to do to simulate a Zoom environment, and where we're recording it and we're playing it back to them in a breakout room. And it's actually a great fidelity for how it's being done in the real world. But yes, overall, it's just enormously challenging and I really feel for those staff that are learning this job under these circumstances. Let's see. Any other thoughts? I'm going to move on. Feel free to jump in the chat if you have any other thoughts.
Yeah, thank you, everyone. We wanted to just leave with a couple of resources. So this umbrella summary is available in our virtual room. I think when you entered our room, I think this was available as a handout. You can also go to the Quick WD website and access different resources there. There we are there, Washington State. You can see the other sites that are participating in this research as well. And this is a, evolving topic and issue that we're all learning as we go. And so we encourage you to reach out to any of us if you have follow-up questions in some of our other partner states. I see one more question here in the chat. Do you believe that having staff already teleworking made dealing with the pandemic easier in the sense of the workers were not? Yes, for sure.
Oh my gosh, we'd already overcome a lot of hurdles just on the equipment front, even though they already had their own mobile, but getting connected at home and having IT support them and having processes set up for that. Oh my gosh, Sarah, I'll let you handle more, but oh yes.
Yes, mentally, it really gave and psychologically, for our supervisors, it really reassured them that we could adapt to 100% teleworking versus the 2 days per week. So we were very fortunate that way. But I don't think that's to take away from all of the work that went into getting us there, that I imagine some of you might have to do post-COVID. For us in Washington State, our teleworking was not being implemented consistently across offices and across the state. And that was a real issue in terms of equity and fairness. And so post-COVID, I imagine even our agency, with all this work that we previously did, is going to have to go back and relook at, like Megan said, how do we continue to allow staff to telework in a fair and consistent way across the board?
Yeah, it doesn't have to be equal, but you want to push for equitable.
Yeah.
As you figure out how to formalize this. Well, we're just about over here. Yes, inclusive. Yeah. Get everyone at the table somehow.
Yeah, get everyone at the table for sure.
Well, here you can see oh, go ahead.
Oh, no, go ahead, Megan.
I was just going to say on this last slide here, you can reach out to the Quick and get connected to us in a couple ways. You can sign up for our mailing list and get our newsletter, or follow us on Twitter or connect on LinkedIn. Thanks so much for your time, everybody.
Yeah, thank you. Have a great rest of your week.